Hello and welcome to Senior Wellness Tips. Here on our channel, we share practical, data-backed advice to keep seniors healthy and happy. Today, we have a special countdown of 5 health screenings that seniors and their caregivers can often skip after age 70, because sometimes more screening does more harm than good. We'll pull from trusted sources like the U.S. Preventive Services Task Force, NHS, Mayo Clinic, and more, so you know this advice isn't just hearsay. Before we jump in, if you find these tips helpful, please give us a thumbs up and subscribe to Senior Wellness Tips for more evidence-based senior health advice. Now, let's get into number 5 on the list. Think of this video like a senior health hack. We're revealing tests you might not need so you can spend more time on fun stuff, like binge watching, your favorite shows, or grandkid visits. We know this can sound a bit backward. More screening should mean better health, right? But not necessarily after 70. Our experts emphasize that if a screening test is unlikely to help you, it's better to avoid it, especially to avoid the stress and side effects it might cause. Think of it this way. Skipping a non-helpful test can actually give you time and peace of mind, rather than taking up your day for a procedure you don't need. We love doctors and we love finding problems early, but even science says there's a point where looking harder isn't always healthier. This is especially true if you or your loved one have other health issues or mobility challenges. We're not saying seniors shouldn't see doctors. You absolutely should. We just mean some specific screenings can go on the shelf for a while. If you're here as a caregiver or child of a senior, stick around. This info could help make your loved one's healthcare easier and safer. All right, let's uncover those 5 tests, with maybe a few laughs along the way. Number 5, cervical cancer screening. Pap smear. If you've reached age 70, you may wonder, do I really need that yearly swab? In many cases, the answer is no. Doctors generally advise that if you've had normal pap smears through age 65, you can safely stop routine cervical screening. This isn't just one doctor's opinion. Major authorities like the U.S. Preventive Services Task Force and the NHS agree that for older women, routine pap smears often do more harm than good. Think about it. After menopause, your cervix, the tissue at the top of your vagina, becomes thin and small. If your pap results have been normal for decades, the chance of a new cervical cancer in your 70s is extremely low. But pap smears can cause a lot of worry. For example, imagine an 80-year-old great-grandma who is called back for abnormal cells on a pap smear. Often it turns out to be a harmless change. That callback typically leads to more tests like a colposcopy or biopsy, which can be uncomfortable and anxiety-provoking for an older woman. Here's a practical tip. If you've had a hysterectomy, removal of the uterus and cervix, for a benign reason, you need no pap smears at all, no matter your age. The official guidelines are clear. If there's no cervix, there's no pap smear needed. So if your mother or aunt had that surgery long ago, they can absolutely skip the pap routine now. For context, decades of effective screening mean cervical cancer in well-screened women over 65 is very rare. That's why after about 65, experts say it's safe to stop. In short, most healthy women over 70 simply retire the pap smear. Instead, they keep an eye on any symptoms, like spotting, and see their doctor if something changes, rather than doing an annual swab. In other words, the annual swab dance becomes a thing of the past. Okay, what's number 4? It's something that affects about half of you listening. Stay tuned to find out. Number 4, breast cancer screening, mammograms. This one applies to about half our audience. Official guidelines typically stop routine mammogram invitations around ages 70 to 75. For example, in the US, the standard advice is screening everyone to 2 years up to age 74. After that, it's up to each woman and her doctor. The American Cancer Society says women 75 plus should continue only if they're in good health and expect to live at least 10 more years. In the UK, the NHS invites women for screening up to age 71. After that, you can still request it, but it's no longer automatic. Why this change? Because as women get older, the balance of benefits and risks shifts. Mammograms are very good at finding small breast cancers, but many of those tumors grow so slowly they would never cause problems in an older woman's lifetime. Yet if a mammogram finds one, it often leads to biopsies, surgery, or radiation. Those treatments can be tough on an elderly body and may not actually extend life. Imagine finding a tiny breast tumor at 80. You might spend weeks going through tests and anxiety for something that would never hurt you. Many experts point out that the follow-ups and treatments for older women can create more stress than the cancer itself would have. To put it in perspective, suppose we screened 1,000 women aged 75 to 85 this year. We might catch maybe 5 to 10 cancers early, but we could end up doing dozens of biopsies on women who didn't have cancer. That's a lot of stress and unnecessary procedures for very little gain. Because of this, many experts say that after about 75, the decision to continue screening should be personal. And let's be honest, mammograms are not exactly a spa day. You have to press each breast between cold plates and hold still. At 80, many women say the peace of mind simply isn't worth the discomfort. As one woman put it, she was over the age of saying cheese for mammogram photos. Of course, if you're very healthy and really want to keep doing them, that's fine. Just discuss it with your doctor. But a lot of women around 75 will say, "No, thank you," and feel relieved. One important note, this advice is about routine screenings. If you ever notice a new breast lump or change, absolutely get it checked out, no matter your age. The point here is that without any symptoms, skipping routine mammograms after 75 usually spares you stress without missing anything important. On to number 3, and this one has a famously long name. It might even make you do a little dance or a bathroom dash. Stick around, because we'll explain everything next. Number 3, colorectal cancer screening, colonoscopy, and stool tests. This one's for everyone. Official advice usually says stop routine colorectal screening around age 75. If you're in your 70s or early 80s, you can talk with your doctor about whether it's really needed. Let's be honest, colonoscopy prep is a nightmare. You have to fast for a day and drink a strong laxative solution to clean out your colon. This fast and flush combo can easily cause dehydration, dizzy spells, and even falls in seniors. Then comes the procedure under sedation. Older patients often take longer to wake up and feel normal again. On top of that, there's a small chance of complications, like a tiny tear in the colon, which can be dangerous in older folks. Now imagine this. At 78, your doctor finds a small polyp during a colonoscopy and removes it. If it turned out to be cancer, treating it might require surgery or chemotherapy. That might be okay for a healthy 78-year-old, but for a frail senior, it could be very dangerous. Here's the key point. Many colorectal cancers grow very slowly. It often takes a decade or more for a polyp to become a dangerous cancer. So if your last colonoscopy was clear at 65, the chances of a significant problem by 75 are quite low. Essentially, you would have had to live another decade to let it become serious. There are gentler alternatives. Many health programs now offer at-home stool tests, like FIT, every year or two. You simply mail in a tiny stool sample, and the lab checks for hidden blood. It's not as thorough as a colonoscopy, but it requires no prep and no sedation. Bottom line, if you've been screened regularly and your colon exams have been healthy, many doctors will say you can safely stop screening around age 75. If you're 75 to 85 and in great shape, you could consider continuing with a stool test. Otherwise, for most seniors, this test can be retired. After all, no one wants to endure the prep if it's unlikely to make a difference. If you're finding this information helpful, please hit the like button and make sure you're subscribed now for more senior health tips. We're almost done, just 2 more to go. Number 2, abdominal aortic aneurysm screening, or AAA screening for short. This one's a bit different from most tests because it's not meant to be repeated every year. It's a one-time ultrasound of the main artery running through your abdomen, the aorta, to check for a bulge or weak spot that could, in rare cases, rupture. Doctors recommend this screening for men ages 65 to 75 who have ever smoked because smoking is the single biggest risk factor for developing an aneurysm. It weakens artery walls over time, making them more likely to balloon out. But here's where it changes. Once you reach your mid to late 70s, most experts say it's time to stop screening. Why? Because by that point, the odds of finding a new, life-threatening aneurysm are quite low. And even if one is discovered, the treatment itself carries serious risks. Repairing an aneurysm usually means major surgery or a complex stent procedure inside the artery. For an 80-year-old, that can mean long hospital stays, risk of infection, heart strain, or complications from anesthesia. In fact, the surgery can sometimes be more dangerous than the aneurysm itself. If you've made it to 80 without an aneurysm diagnosis, many doctors agree you're probably in the clear. The aorta has proven strong enough to last, and further testing may only bring anxiety or lead to risky interventions. So, while AAA screening can be life-saving for younger seniors, especially smokers, it's one test that doesn't need to follow you into your later years. Sometimes, not looking is the healthiest choice. For perspective, the NHS gives men a one-time AAA scan at 65, but doesn't automatically invite anyone after 75. Women rarely get screened at all since AAAS are much less common in women. Over time, experts have seen that very few new large aneurysms pop up in men after 75 if they didn't have one earlier. That's why it's not worth the worry. Simply put, if your loved one made it this far without an aneurysm diagnosis, it probably means it's safe. Also, consider priorities. Controlling blood pressure and quitting smoking are ways to reduce aneurysm risk without surgery. In fact, the USPSTF gives a B recommendation for this one-time 8AA scan in men 65 to 75 who have smoked, meaning they say it's a good idea, but a D recommendation for anyone older. In plain English, that means experts believe it's harmful to keep scanning after 75. So for number 2, if you or an older man in your life is past 75 and wonders whether to get the AAA ultrasound, most doctors will say it's okay to skip it, unless there's a very specific reason. Instead of a scan, just focus on healthy habits like managing blood pressure and cholesterol. And now, for number 1. Guys, get ready. This is the big one that affects a lot of men and their families. You might be relieved to hear this part. Stay tuned. Number 1. Prostate cancer screening, the famous PSA test. Gentlemen, this one's the biggie, and it's where routine might actually mean risky. If you're 70 or older, major medical organizations, including the CDC and the U.S. Preventive Services Task Force, recommend against regular PSA screening. That's because, past a certain age, the test often causes more harm than good. Here's the simple truth. Most prostate cancers in older men grow extremely slowly. In fact, many men in their 70s or 80s already have tiny, harmless tumors that will never cause symptoms or shorten life. The real danger often starts after the test. A high PSA level doesn't necessarily mean cancer, but it triggers a cascade of follow-ups, starting with a prostate biopsy, where multiple needles are inserted into the gland to collect samples. For younger men, this might be just uncomfortable. For older men, though, it can bring real complications: infection, bleeding, pain, and anxiety. And if a tumor is found, even if it's small or inactive, the word cancer often pushes patients toward aggressive treatments like surgery or radiation, treatments that can change life dramatically. Studies show that about 1 in 5 men who undergo prostate surgery experience urinary incontinence, and up to 2/3 lose erectile function afterward. Radiation treatments carry similar risks, along with bowel irritation and fatigue. That's why most experts agree. If you're over 70, it's often better to monitor symptoms and have thoughtful discussions with your doctor instead of automatically testing. In many cases, watchful waiting isn't neglect, it's wisdom. Bottom line, when it comes to PSA tests after 70, less testing often means more peace of mind and fewer unnecessary risks. Imagine this scenario. An 82-year-old man gets a PSA test. A high value sends him down a rabbit hole of tests and treatments, and he ends up dealing with bladder leaks. All for a cancer that, in his case, probably wouldn't have shortened his life. Many older men frankly say, "I'll pass on that stress." Quality of life matters. That's why, after 70, the default advice is to skip the PSA test. Of course, if you have symptoms like difficulty urinating or a strong family history of aggressive prostate cancer, your doctor will investigate. But for routine screening when you feel fine, the harms usually outweigh any benefits. Even Medicare and many insurance plans now often refuse to pay for routine PSA tests in senior men because studies show it's not a good use of money or effort. In practice, if a man over 70 is diagnosed with prostate cancer, doctors often choose active surveillance, monitoring it carefully instead of treating immediately. This approach reflects the thinking behind skipping PSA screening in the first place. We're more focused on comfort than aggressive treatment. So the number one test to skip after 70 is the PSA. Guys, you can tell your doctor you're opting out of it, unless there's a clear symptom. So that completes our countdown of 5 screenings to skip after 70. We covered cervical pap smears, mammograms, colonoscopies, the one-time AAA ultrasound, and PSA tests. Each of these is something many of us did routinely when we were younger, but now experts say they may not be necessary. The goal is to avoid what's called overdiagnosis, finding and treating things that wouldn't hurt you, and focus on tests and habits that really help. Remember, this advice is based on official guidelines from organizations like the USPSTF, NHS, CDC, WHO, and Mayo Clinic, not just rumor. Always discuss any decision to skip a test with your doctor, who knows your health best. If you and your doctor agree a screening isn't needed, you can breathe easy knowing you're following evidence-based guidance. Keep managing your blood pressure, diabetes, cholesterol, and get all the vaccinations and simple checkups that truly matter, like vision, hearing, bone density, and immunizations. Those things continue to protect you. If you found this video useful, please subscribe to Senior Wellness Tips and hit the bell icon so you don't miss our future videos. Share it with friends or family who might benefit from these senior health insights. We appreciate all our subscribers and we care about your health. So there you have it. Stay healthy out there, and as one senior doctor said, skip smart, live well. Enjoy. You got this. Stay safe.